Ladies and gentlemen, welcome to the Teachback session on SPSP Medicine's Stakeholder Exchange conference call hosted by David Maxwell. My name is Zoltan and I'm your event manager. During the presentation, your lines will remain on listen only. If you require assistance at any time, please key *0 on your telephone and the coordinator will be happy to assist you. I would also like to advise all parties that this conference is being recorded for replay purposes. And now I would like to hand over to David.
Good afternoon and thank you very much for the introduction and welcome. It's great to have everybody along to the launch of our 2018-19 SPSP Medicine's WebEx series with a particular focus today, as the title says, a Teachback session on the Stakeholder Exchange, which we held in February earlier this year. So it is great to have you along. And as part of the launch, we just really want to reiterate the priority areas that we'll be focusing on over this next 12 months of being transitions, omissions, and high-risk medicines. And I think the new elements to all of this is really to build upon the outputs of the Stakeholder Exchange that we held in February and how that influences the topics, the discussion, and how we move forward around these three areas of transitions, omissions, and high-risk medicines, all with the ultimate aim of supporting, sharing, and learning across Scotland as we work to reduce medicines harm from safety. So for those who haven't joined our WebEx before, we have purposely muted all of the lines at the moment, and that's just to allow the presentation components of our WebEx today, but we will be opening the lines later on to allow some discussion, and we're really keen to get your thoughts. So participation is really quite key to the work that we're going to be doing here today. What we also encourage people to do is use the chat box, and you'll have seen that myself and Arvind, who's in the room with me as well, have already introduced themselves in the chat box. So we encourage you to use the chat box by selecting all participants, and if you can do that now by letting us know who you are, what you do as a day job, and where you actually do that job. That'd be great, so we can get an idea of who's in the room with us today. So Jackie, thank you so much. It's great to have you along from Esher and Aaron already. Thank you. So if you can all do that. And as mentioned before, we are recording this WebEx, and that's for the purpose of being able to then share that on our website with an audio and a video recording of this WebEx today. So you can share that with others as well. So just to introduce the team in the room with me today, we have Arvind and Kirsty, our Administrative Officer as well for SPSP Medicines, and myself. And we have a new project officer who's going to be joining us next week, so we'll be introducing her as part of the WebEx series for May, and we look forward to introducing Lorraine to you then. But before we get started into the WebEx, we do want to try and make this as engaging as possible while you're all on mute. So we're really keen to get an idea of where everybody's coming from a professional perspective. So we have the polling question to ask, which of the following professions best describe you? Whether you're a patient or a service user, someone who would identify themselves as a medical profession, or nursing profession, pharmacy, or other. And if it is other, please let us know in the chat box. So, Dalton, would you mind opening the poll, please?
Ladies and gentlemen, your polling session will now begin. To cast your vote, please choose one of the answers and click on the submit button. You have 20 seconds to do so. Please start now.
And while everyone's submitting that polling question, the answers to the polling question, it's fantastic. We can see here we've got representation from the north and the south of the country, as well as a crossing over into Northern Ireland. Daryl, it's great to have you along. And of course, of our colleagues across the Central Belt. It's just a fantastic way of getting in touch. And there are some people here as well, I think, for me, new contacts, and it's great to have you along as well. So once we've got the polling results available, we will then move into the content of our Teachback session today, and we'll just wait for those polling results to appear. Well, it seems we might move forward while we wait for the results, because I think what's really important for us today is getting your opinions. So we mentioned earlier that we are continuing the WebEx series on transitions, emissions, and high-risk medicines. And today, really, you can see here that the focus is around building on the outputs to inform this WebEx series. So your contribution today is going to be absolutely vital. And you'll see the results of the polling question today. We've got a range of folk representing medical, nursing, and pharmacy, as well as a few others. And we would encourage those who weren't able to answer this poll to try and participate in the next. But we are testing a few new things as well as part of this WebEx series, and we will get to that in a moment. But for the objectives of today and our time with you, we're really keen to summarise the stakeholder exchange proceedings, to share the draft key findings and also describe the process of how we've gone in analysing the information that came from the day, and then seek your confirmation in terms of the findings and agree next steps. So you can see we've got quite a few things that we'd like to get through, and we really do look to you to help inform how we move forward. So again, it's quite key. Participation today is absolutely vital. Arvind and I and Kirsty can look at the results and be quite confidently sure within ourselves, but we're really wanting to make sure that the findings and how we move forward is something that's an agreed approach and something that you feel like you've been informed and able to influence. So we really do value your participation today. So one of the things we mentioned was a test. So as part of the WebEx series for 1819, we're testing the idea of doing some pre-reading and sending out some information and exercises in advance. So we've asked people to, in advance of this WebEx, to review the output summary from the morning sessions and consider the 2 reflective questions that were included in the summary. And we will get to that as part of the WebEx today. And we also provided an Excel file that was available for download, looking at the range of improvement activities that we've identified as outputs from the day, and asking you to consider about how easy they would be to implement where you work, and also consider how much of the impact they were likely to have where you work. So again, this is a test for us, and we're really keen to learn from you about the feasibility of taking such exercises through as part of our WebEx series. So we're really keen to get your feedback just now in terms of the pre-reading and through another polling question. And please do be honest, we're looking to learn how easy it was for you to actually complete the pre-reading for today's WebEx. So the options that we've really provided today is that you're able to do both of those things, which would be A, looking at the reflective questions and the survey. B, you're able to do one of them. C, you didn't actually have time to do the pre-reading, and again, we're keen to learn about that. Or D, if you weren't aware that there was pre-reading available today. So would you mind, Zoltan, opening the poll, please?
Ladies and gentlemen, your polling session will now begin. To cast your vote, please choose one of the answers and click on the Submit button. You have 20 seconds to do so. Please start now.
And we do encourage people to be honest. As I say, we're testing this, and if it's something that people find valuable, we will endeavour to continue to do. But if it is something that people find too challenging in terms of time commitments, we're also really keen to get that feedback as well. So we're really gracious of people giving us that feedback through the WebEx today. So while we're waiting for those results to come through, we're just looking at providing a summary of the proceedings. For those people that weren't able to join the stakeholder event in February, it was at Edinburgh at the Cosler Centres near Haymarket, and we were able to bring together just over 80 people from around Scotland having a look at a range of different aims. Just jumping back, we can see the polling results now, and we've got, again, a range of people, and thank you again for honesty. We've got one person that's declared they're able to do both. A group of people, and the majority of people that were able to complete at least half of the pre-reading, which is fantastic. And again, there are a few folk that weren't aware that there was pre-reading available, so we can work on how we better promote and actually advertise some of that information in advance of the WebEx. So again, thank you for taking your time to reflect on that. So the aims of the stakeholder event back in February were to first of all share the achievements of the first 2 years of SPSP medicines, to discuss national and international strategies for achieving medicine safety to what we're aware of, and use those pieces of information to then help inform future priorities. So the day itself was, I guess, a range of both didactic presentations from the front, and we had Rona from Marie Curie come and talk about medicines in a complex system to help us set the scene. To then look at some more tabletop-focused group discussions, focusing on some key questions around what matters to you and exploring levers for further change and how we support medicine safety looking forward. And today's WebEx really is focusing on those two particular sessions around what matters to you or what matters to us, and looking at the levers for further change and how we might drive further improvement in the future. So without further ado, I'd like to pass over to Arvind, who's going to run us through some of the tabletop exercises and our analysis so far.
Thank you very much, David. I recognize some of the names, and some of you were there at the Stakeholder Exchange. But for those of you who weren't there, the bits prior to asking people about the differences that they'd like to see in practice were in some ways to help prepare them, get delegates to then give us answers that really matter to them. And the aim of this bit was to try and identify outcomes from medicine safety work that would really be relevant. What are we doing it for? What would good look like to us? And in the pre-reading, we sent around the 20 differences that delegates prioritized. That's like the outcomes that they wanted for medicine safety. I recognize that many of you wouldn't have had a chance to look at it before this meeting, but even if you could look later at it, that would be really helpful. But for those of you who have had a chance to look at it and been able to reflect on it, did any of the responses appeal to you or put you off? I'd be grateful if you enter something in the chat box just now, if you have any particular questions, and we'll stop and ask as well. But it allows many people to write at the same time, and for me, it allows me to write, allows me to put my views better if I type it in. So be grateful if you write about any responses that particularly appeal to you or put you off. And for those of you who've looked at those 20 differences, are there any other things that you would add, other outcomes that we should be looking for? So Zoltan, can we just open the lines for a few minutes so we can hear from participants, please?
Yes, of course. And the lines are now open.
Thank you. So can I hear from anybody who's gone through the material, the 20 differences that delegates had picked out? What did you feel about it? Okay, we've got a... Okay, what I'm going to do, I think sometimes it's difficult to go through this right now. We can come back to it. If you have any particular views, you can look at it. David, perhaps if we even provide the link just now, people can look it up while we are chatting, and then they can come back to us. So the 20 differences we are talking about are simply 20 lines of things that people had written. Each table, we had 10 tables, and each table had to choose 2 things that they would like to see. And they went through a process where every individual picked up something, and then they then had to prioritize it and moved on. Thank you, Deirdre, for your answer. Can I ask you to just talk to the group as well, just in case some people don't have access to the telephones?
Yeah, sure. Could you hear me?
Yes, very well.
Yeah.
Thank you.
I think there was quite a range of involvement, co-design with patients, etc., that was discussed on the day, and I think from my point of view that sounded like a good way forward in testing some potential tests of change. Probably I found some of the other ones a little bit more difficult to achieve when I actually scored them in ease of change. Yeah, quite variable therefore as a result, because I think all the benefits of that list were really good suggestions. Maybe some needed a little bit more clarity what they meant, but for me, yeah, certainly involving patients in their own medications is the way forward, where possible, I think was quite a positive thing.
Thank you very much for that, Deirdre. Anybody else who wants to say anything about this, or can we come back to this later?
It's Jacqueline Seenan from Ayrshire and Arran.
Hi, Jackie.
To be honest with you, I can't really pick out any in particular. I think that they are all important, and yeah, there's not any that are jumping out at me that are any better than the others. Actually, looking through the list, I think they're all really important. And I think they're all things. I do agree with Deirdre, though. I think a good way forward with a lot of the work we're doing is really to empower patients. We actually had a local meeting this morning about some things, and that was one of the things that came through, was actually maybe having some campaign around making patients more aware of, you know, what happens when they come into hospital, and you know, what the pharmacist's role is and what happens with their medicines, etc. So I do think that theme of patient empowerment is important, but I would really say all 20 of those are really good.
Thank you, Jackie. That's really good to hear. That's exactly the way we think, and I think it's really, we were surprised, not surprised, let me put it this way. It was really helpful to see what people came up with, and some of the responses were new avenues, and I'll touch upon it later as well, but so much of it was really re-energizing for us, because I think it agrees with what we would like to do, but it's great to hear from people themselves.
Okay.
Anything else anybody wants to add? Okay, so we at this point we're asking each individual to think about what would matter to them if they, in their workplace, what would define high quality of patient safety in relation to medicine. And then once this was put together, David, myself, and Joe Matthews, who is our lead within iHub, during our lunch hour, quickly put together a summary of what people said. And this is one of the challenges. I'll come to the analysis later, but putting together lots of what people said into a few themes is always challenging. We sent this summary around as well, and I'm just going to leave it there for just a moment. I would, we will be exploring a further version of it, but this was fed back to the audience at that time to see whether people wanted to add anything else, or whether this this was suitable for us. This adequately captured what the audience had said to us in the morning. And then what we did was we moved on to trying to draw together what the actual change ideas would be, the things that would make those outcomes possible. We shared with the audience the levers for change that we, within SPSP Medicines, with the advisors of the Clinical Advisory Group, had developed as 6 main levers for change with the participants at the Stakeholder Exchange. But we got people to put together what their own ideas of change, sorry, the slide changed. We got people to think through their own ideas for change, and we offered what we had put together as levers for change, and asked people to then comment upon our ideas as well as build a theme from that. So what we did at that point, after presenting it, was to take feedback, and we changed. You see in red the bits that were altered. People in the audience felt strongly that it's not enough to have clear staff roles and responsibilities. They had to have the competency to be able to deliver on the patient safety outcomes. So there was things about education and training and IT systems. There was something about other digital platforms and solutions that were beyond HEPMA alone. We asked the audience to take their change ideas and actually put them into the framework that SPSP Medicines had developed at a national level with advice from the Clinical Advisory Group to see whether what we had been thinking about at least loosely fitted with what people came up with. Sultan, can we mute the mic for a little? Okay. And then we asked people to put this together within the framework of levers for change we developed, and also asked people what changes they can make moving forward in the next 4 weeks to bring about improvements, and challenged people to come out with ideas that actually they could do rather than just general change ideas. And then we got back a lot of responses, which David and I have spent several weeks working on. Now, I think it's important for me to share the process that we went through to come to the next steps. I do that partly because the results that you see will perhaps be easier to understand, but also so that you have a sense of how much of work has gone into it. So what we did was we took all the responses from the morning session, the what mattered to us, and the afternoon session, the change ideas, and on an Excel spreadsheet, we then coded them. We pulled out smaller elements that were common across different people's responses so that we have a few themes that can be shared with a wider group, and then we could prioritize or work on it. And this process was far harder than I had imagined. We went through, so what we did was each of us independently initially drew out separate themes, and then we discussed and found that we had to update several of them because we had different ways of looking at it. We updated it and put the updated themes back into the spreadsheet and found that many things had to be adapted again. And this iterative process, we did, I think, 7 versions of the change ideas and 4 versions of what we initially called the what matters to us. We thought of them as outcomes until we amalgamated them, because at the end, it seemed to us that both what people were calling in the morning, what would matter to them, and the change ideas were all in one way or the other processes of change, and there were some common themes to them. So we worked through all that, and I'd like to present that to you, but what's really helpful for us is for you to look at it and do what only David and I have done so far, to really challenge those themes as well as then try and work out what's helpful and what's not helpful. So the analysis had some challenges. We'd initially started with the idea that the morning was about outcomes, what people want, and afternoon was about processes. We putting it together later to produce a single result was challenging, and you'll find hopefully that we managed to achieve it. But there are some of the ideas that we finally in the list that we sent for ease benefit analysis fit better with outcomes, and some fit better with the processes. As with any qualitative assessment, people's responses sometimes had multiple ideas in the coding, and sometimes one code or one improvement activity linked to many people's responses. What we did when David and I worked through this was we tried to be as generous as possible, giving as many improvement activities as possible for each person's response, so that we could draw as much as possible from the audience, from the participants' ideas. We've also simplified the language, but or shortened the phrases, because when we tried to put it into graphs and into spreadsheets, having long sentences or long improvement activities made it difficult to distinguish them. But I recognize that in shortening them so much, we might have lost some of the meaning. They may well make sense to David and me, but not to other people. So please let us know, and I'm really looking to your help to then make that better and improve the way we presented it. So here's an example of a change idea. One of the tables, they said a thing that would make their idea possible would be consider compelling campaign, and you can read that for yourself. And we brought 3 separate things into that. One was about positivity in language. One was about doing more QI work, and perhaps whether it's at the national level or at a board level, it's about how people support and build more QI projects. And also it's about building networks, because for a campaign to succeed, we're talking about moving it from one place to another and learning about it. So that's the kind of process we undertook for the analysis. So with all this, we then developed the pre-reading and sent it, and we sent 30 types of improvement activities. And I apologize to those of you who didn't get a chance to look at it. We will try and improve this, and we are constantly learning. But what we did was we sent those 30 improvement activities, and if we had all been meeting in a room, we'd have tried to get you to put it on an EASE benefit diagram. But we decided that even for a WebEx, it would still be helpful if we could draw things in a different way. So for those of you who have not had a chance to actually look at that work, the task was to give a score to each of the improvement activities for its ease and its benefit on a scale of 1 to 5, and ask people to then and then we tried to put it together, and I'll show you what we came up with from that. We also asked people how easy it would be to do any of this in their workplace and what the impact would be if there are any other suggestions. So this one picture perhaps is the best one as far as we could put together to give you an idea of how we can use it. What we did was we took the E-scores, and for each of those parameters we gave a score of 1 to 5, and we multiplied the two to get an area under the curve. In the EASE benefit diagram, it will be the same thing. And then we arranged all those improvement ideas according to people's responses, and these are the top 10. And the ones that are underlined are ones that David and I felt were novel. Some of them we've not really pushed much, and in fact we're not entirely sure how we can move this forward. If this is something that has a high impact and is relatively easy, ensure regular review of medicines, and this basically relates to people who had written that it would be really helpful if we could ensure that every time people saw a patient they actually reviewed the medicines, that kind of thing. Improved safety culture, there were several responses that were about culture, and I think David and I are going to have to think very hard and really listen to advice from many of you about how we actually study the culture and influence it. There were many responses about structured discharge planning. Now, we have spoken about medicines transitions and medicines reconciliation at discharge, but this the responses about structured discharge planning were more about arranging the activities in such a way that the medicines reconciliation happened along with a more efficient discharge. It was similar but not exactly the same as medicines reconciliation at discharge. And there were lots of responses about ensuring that staff had the right information to hand to make the decisions. And I'm aware that there is work happening across Scotland in improving information available to staff to make the decisions, but it's not something that we've pulled together really well. And it felt to me like it was a real encouragement for us to try and bring that together. So we'd be looking for ideas to move forward with that.
So Arvind, if I can just jump in. So what we've actually got here are responses that have been coming through our clinical advisory group. So 11 people responded to this initial survey that we've purposely then shared with you. I'm aware that there are a number of other individuals that are on the call today that are not part of our clinical advisory group that also provided responses. So we want to say thank you for that. But this is a response of 11 individuals in terms of what they thought was the most benefit and the easiest to do. And I think the other thing that we wanted to highlight too, that in terms of the top 10 things that the BCAG identified as being easy, and the top 10 things that they identified of having the most benefit, there was only one type of improvement activity that hit top 10 in both lists. And it's not surprising, it's the one that's at the top, using data to drive improvement. All of the other 9 things featured here did not appear in the top 10 in both sides. I hope that makes sense, but there was only one improvement activity that the BCAG group identified being of benefit and of ease within the top 10 responses that we got. And I think that's just an interesting reflection, and I think it's confirmation for us too. As an improvement program, we're absolutely committed to be using data to help drive improvement. So that's confirmed a way forward for us that we need to continue doing. I just needed to sort of reflect that.
Thank you very much, David. No, that was really helpful, and I was meant to do it. I forgot. And what we intend to do, as David said, this is only 11 people's responses. What we intend to do is to bring together all the responses that we can get by the end of this month, and put them together to help us then develop a better idea of what are the best things to go for. So I don't think any one of us can be absolutely sure what the best the improvement activities that have the greatest benefit or the greatest ease are for the whole of Scotland. And what we can do is to take many people's views and build a joint sense of it, and then use that to prioritize our work. So what I think the next steps really for us and for you are to discuss and help develop this work. I'm really keen to learn more and get more feedback. I'm aware that this is far more complicated in terms of what I think of as a qualitative data than anything I've done before. We've taken people's responses, we have themed them, and then we are now presenting it back to people who have experience and understanding of working in similar situations, to get you and all your colleagues, whoever you can persuade to do it, to then help us improve the output even further. And within this, apart from putting things together in nice documents, we'd also love to know which of these you can actually take forward and actually work on. Are any of these improvement activities things that you can do over the next 4 weeks? Are you already engaged in activities that would fit in within these improvement activities? Are there things that you can discuss with your team and get them enthused? We'd be keen to know. So I'm going to pause here for a minute. Zoltan, if you can open the telephone lines, please. Oh, they are open.
Yeah, I think so.
And can I just take any responses? Is there anybody who wants to talk about the improvement activities that we'd mentioned among the 30, and anything that they would be particularly looking to discuss with their teams moving forward?
Well, I'm aware that there's a couple of people that didn't have access in terms of being even aware that this was available to pre-read. So I guess for me, the comments we've had from Anna and Daryl to say they've not seen it before, and I think, Daryl, you had a look through rather briefly just now in terms of while you're on the WebEx. I would really value the time for you after the WebEx to actually go through the 30 elements and email us back in terms of what your rankings would be of ease and benefit. I think Arvin mentioned before, at the moment we've got potentially 14 responses. We've only shared an aggregate of 11 today, but we're really keen to get as many people as we can, particularly those on the WebEx today that haven't had a chance to look at it, to go through the 30 things and let us know which of those you think would be the easiest to do and which ones you think is going to have the most benefit, and to email that back to us. I think there's also a potential opportunity to use this tool with your teams locally. So if you've not had a chance to go through with your teams what they think is going to be the easiest thing to do and what type of improvement activity would have the most benefit, this could be a resource to go away and get your improvement teams or your ward teams or your pharmacy teams or your nursing teams to actually get some feedback around the types of improvement activities that would actually have the most traction in trying to improve medicine safety. So I can see already that, Deirdre, you've said you're going to take along to the Medicines and Safety Quality Group. Absolutely fantastic. And I know you've already provided a response in terms of your thoughts of the ease and benefit, which we really do appreciate. So my personal challenge to everybody else would be to do the same if you haven't. The link that we've provided earlier to the website will give you a link then to the pre-reading for today, the April WebEx, and the Excel file, and there's guidance in there to talk about the scales and also where to send it to once you've completed it. So I would really, really value people's time to do that.
Deirdre, I'm sorry, it would be really helpful to get a sense of how long it took to do this, just so other participants might also get a sense of it. Just that ease and benefit spreadsheet to score it, how long did it take you?
Not any more than 10 minutes. I think probably the benefits, I think I answered this earlier by mistake, but the benefits, to me, the majority of them, I would say, are all good. So probably the ease of change, that would take a bit more thinking, but certainly not any more than 10 minutes.
Thank you for that.
Also knowing the detail under what would make all of these happen as well. So I suppose it depends how much you're thinking in depth.
Yep. Thank you very much. Is there anybody else who's tried it, who's in the audience?
So I do know Alec Murray has completed it and sent it in, and I know Alec is on the call today, so I'm happy to pick on Alec. So what were your reflections, Alec, in terms of the time it took and the usefulness?
Thanks for picking on me, and I found it extremely easy. It is just a case of going through the list, always mindful of which is the most benefit and which has the most impact, and a really good way of prioritising really for, I think personally, probably for teams and probably nationally, to help focus the work in the future. It doesn't take any time at all, but it's really, I suppose, very good as a reflective tool, or to for clarity really, to be mindful of the list and which to focus on for future.
Thank you very much, Alec.
And Deirdre, thank you too for your reflections again. Yeah. Okay,
I'm going to move on, but we'll have more time to discuss, and if anybody's got any other questions, comments, please type it in the chat box. Like I said at the beginning, and if some of you have missed it, we look at this chat box later on anyway to look for ideas, suggestions that we can use for our work. So I'd be really grateful if you can write in, or we can, or give us a shout at the end of this. So I've asked the audience, I've asked you what you are going to do, and what we are going to do in SPSP Medicines within the national work is to actually use the responses on this ease benefit spreadsheet to inform our work. Now, inform our work can mean anything. I apologize because it's not specified more clearly than that, but we will take it to the clinical advisory group. We will prioritize the things that you and your colleagues prioritize in their responses. Deirdre is right. It's very difficult to know what the next steps and the processes that will achieve those improvement ideas are, but what we can do is to pick a few of them and then ask people about their ideas, what they've done, and share it with all of you. And that's something that we will do once we have the more comprehensive response from everybody. We will write all this up and produce it in a report as well that will be available on the website in due course, and that you'll all be able to see. There are some challenges in doing this work. I love the idea of prioritizing based upon ease and benefit and picking the things that are of highest ease and highest benefit. But there are some things people said that really made us stop and think. There were some fantastic responses. One was about asking, somebody had said, I'm going to ask patients for feedback every time when I do something. And that's fantastic. It is, we all talk about person-centered care and about co-design with patients, but that simple question about asking people to, asking every patient or asking many patients, what do you think about our process, what could we do better, seemed a simple thing to do, maybe it isn't, but it's how do we fit it into this whole prioritization matrix. I had, prior to the stakeholder engagement event, put a lot of my heart and soul into developing more about promotion of recognition and supervision for medicine safety work, because it seemed to me that one of the things that we were not doing that could help us is to have e-portfolio for trainee doctors in particular, have a specific or a bespoke prescribing related assessment so that tutors, supervisors, and trainees have a better shared mental model about what medicine safety means. And this will also mean that trainee doctors will actually prioritize it, because it's been my experience that they value the things that their consultant, quote unquote, actually values and that they look at as supervision. But it's not there. It was the penultimate thing when we did the ease benefit. So what I want to say here is that no matter how the prioritization works, this is not to say that the projects that other people are doing that are not high up on this list are not valuable. I think we need to keep doing it, and ease and benefit are now things that we've put together based upon a gut feel. But it may be that actually when we do things, the ease and benefit are different, and we may then be able to share it with people and change the scoring over time. One specific response from a table was that there should be a patient self-administration of medicines working group. Now, David and I were not entirely sure whether they were referring to developing a patient self-administration of medicines working group within their board or work area, or whether they were suggesting something bigger than that. But it's something that's really close to my heart, and I've always found it frustrating that patients who are mentally completely capable seem to have to give up on all control of their medicines use once they come into hospital. And it's the kind of thing that didn't fit into the matrix because there weren't enough responses for that. So there are other responses that were really, really valuable that we will be providing in a fuller document, and I'd be really keen for people to tell us how we move forward with that.
And Noreen, I know that you're on the WebEx with us today from the Western Isles, and it's great to have you. So Noreen is the Excellence in Care Lead who's working with us on the omitted medicines work. And I think we had a WebEx earlier this week, and the issue of patients self-administering their own medicines before they were discharged from hospital as a way of, I think, firstly reducing the rate of omitted medicines was discussed, but it's also being linked quite clearly to improve patients' readiness to actually go home and to continue taking their medicines. So, Noreen, I don't know if you wanted to comment any more on that, but I thought it was quite interesting that it came up through our stakeholder engagement work, but it's also come up through the omitted medicines work that we're doing with you.
No, it's just really agreeing with what you're saying, how everything's kind of linked.
Yeah. So we're really keen to explore this a bit further. I mean, I guess what I'm really clear is I'm not volunteering today on this WebEx because it's being recorded to actually convene a working group, but we'd be really keen to explore whether that's something of interest nationally or whether it is something that would be a board-level piece of work we could then share. Okay. Right.
Thank you very much, David. And I'm now going to hand the presentation back to David, and we can talk about next topics and the rest of the WebExes.
Yeah, thanks, Arvind. And I guess this is just an opportunity to confirm really our commitment. We got feedback at the end of last financial year that this WebEx series was of value and it was something that we should continue. And I think the findings from the Stakeholder Exchange in February have really given us a foundation of what people would like us to focus on. So in terms of where our direction of travel, we've got a couple of broad topics that we're engaging people to present over the next 12 months, whether it be engaging patients, and I think it's really, really valuable that a couple of people, and Jackie, you said earlier too, that patient empowerment is really important.
Yep.
So we're going to hear from NHS Tayside in May about their local group that's been specifically set up for the patients and the public around medicines and what the role and function of that group is. But I'd be really keen, so the pre-work for around this would be more around preparing to come to the WebEx to share about local approaches that are in existence or even thinking about how you can better engage patients. So Jacqueline, I'd be really keen for you to come along next month perhaps to share a little bit more about any further thoughts that Esha and Aaron have around that campaign approach. That would be fantastic.
Yeah, if we've taken anything else forward, that's fine, David. I'd be happy to share anything.
Really, really good. So we also are aware that one of the kind of colloquial phrases that we pulled out as a theme was really around who does what. And that was something that came through quite strongly in the types of improvement activities and what would better or good look like as part of the Stakeholder Exchange. So we're committed to share with you different models of care that different boards are putting in place, whether it's in a health and social care partnership or a GP practice, different ways of working to actually ensure medicine safety for patients. And that will be a topic one topic over the next 12 months. We've already talked about models of supervision, and so in August we're actually going to hear from Northern Ireland, and Daryl, I hope this is not new news to you, but colleagues from Northern Ireland are going to be sharing 2 different approaches that they're using around improving prescribing, and it's particularly around feedback models and supervision models and how that's working for them. There was a big ask around learning about digital solutions. And so again, we're engaging with boards that are undertaking particular unique or bespoke digital solutions and learning about their impact around improving communication at the interface. And we're also committed to share our collaboration with other national programs. And I mentioned before that Noreen's with us today in terms of excellence in care. And so one of the WebExes later in the year will be sharing the outputs of the testing of the emitted medicines work. So that's a kind of a brief summary of the topics that we're planning to cover. We're really keen to make sure that if there are any other things that people would find of value, that we do that. So the question and opportunity to influence that is always there. You can please get in contact either via the chat box, Speak Now, or email to let us know if there's anything else that you would want covered throughout the year. There are a few other topics that we've got in train, but because we've not actually got any confirmation yet, I don't want to necessarily advertise them, but we're really keen to get your thoughts on those. So I guess we've covered where we needed to get to today, and I appreciate that there's probably opportunities for individuals on the call to go and have a look at the pre-work, and we can call that post-work as following the WebEx. I said at the very beginning, participation is absolutely vital. So first of all, thank you for those that have contributed today in the chat box, who've completed the survey and also spoke during our WebEx. Can I thank you also in advance for those that have not yet completed the survey to do so and email back to the team. We do ask that we're looking for responses by the end of this month, the 30th of April. And whether it's something you do as a group locally or you do individually, we just really appreciate your feedback. So without further ado, I do want to just confirm and kind of our promotion of the next WebEx, and that's around engaging patients. We will be using the model in NHS Tayside as an example, but we're really keen for everybody coming to the WebEx to think about what they're currently doing, or what they think they could be doing to actually improve working and engaging patients in the medicine safety agenda. So we really look forward to meeting with you on the 3 p.m. on the 17th of May. So thank you very much.
Thank you very much.
Ladies and gentlemen, that concludes your conference call for today. You may now disconnect. Thank you for joining. Have a very nice day.